Hello everyone. My name is Dr. Nia Robinson and I'm a gynecologist at Brigham and Women's Hospital, a teaching affiliate of Harvard Medical School in Boston, Massachusetts. I wanted to tell you about our website, www.fibroids.net, as well as give you information about a genetic study that we're doing to look at causes for uterine fibroids. We know that surgery is often the only treatment option available for uterine fibroids. We would like to determine if we can provide other treatment options for women like you, your sister, your mother, your grandmother, other women you know, and women to come who may have uterine fibroids. Although our study is not specifically looking at treatment for uterine fibroids, we do hope to be able to provide non-surgical treatment options in the future. Uterine fibroids are a serious women's health problem that often affect African American women. Uterine fibroids are the most common pelvic tumor and are present in approximately 1 out of 4 women. We know that uterine fibroids are approximately 3 times more common in Black women than white women and may run in families. Many times uterine fibroids are asymptomatic and may go unnoticed. However, with careful inspection of the uterus, approximately 70% of the time fibroids will be present. The average affected uterus has 6 to 7 fibroids. Uterine fibroids are the most common reason for hysterectomy in the United States, accounting for approximately 200,000 hysterectomies every year. This accounts for up to 1/3 of hysterectomies. In addition, approximately 1 out of every 5 visits to the gynecologist is for uterine fibroids. Any guess how much this costs our healthcare system every year? A whopping $2.1 billion. Fibroids may cause profuse vaginal bleeding, anemia with possible need for blood transfusion, constipation, urinary incontinence, preterm labor, recurrent miscarriage, and other gynecological and reproductive problems. Despite their major medical impact, the research community and media have focused very little on uterine fibroids. Currently, there is no completely effective non-surgical treatment for fibroids. Researchers and clinicians at Brigham and Women's Hospital and Harvard Medical School in Boston, Massachusetts, founded the Center for Uterine Fibroids. Our center is dedicated to finding the cause for uterine fibroids, providing less invasive treatment options, and to make the public more aware of this significant women's health issue. Now let me explain to you a little about the research we do in the genetics of uterine fibroids. As you may know, our body is made up of building blocks called cells. And cells contain genes that determine specific characteristics about us, such as eye or hair color. Genes are inherited, which is why your child may look like you. But sometimes genes that are responsible for a certain medical condition are passed on as well. For example, genes that may increase the risk of developing diabetes. At our center, we are conducting a study to determine if there are any specific genes that may predispose women to developing uterine fibroids. We hope to use the results of this study to help manage uterine fibroids in generations of women to come. Currently, our study is enrolling families in which at least one sister pair has uterine fibroids. For example, you and your sister, your niece and her sister, or your mother and her sister. If there are 2 sisters in your family who have uterine fibroids, then other family members are encouraged to participate if they are interested. This study involves filling out 2 surveys and providing a small sample of blood. This would all be done by mail at no cost to you. If you and your family are eligible and interested in participating, please email or call us. We will send you all of the appropriate study materials by mail, along with instructions. Please indicate your relationship to each family member, whether or not they have fibroids, and if they are half or full sisters. Thank you for watching this clip, and please check out our website at www.fibroids.net for more information. Help us help many women.